All right, so now we're going to move on to non-surgical joint pain relief for the shoulder. So this is the big one. I would say the majority of what we see in our office for non-surgical joint pain relief is going to be the shoulder, it's going to be the knee. The neck and the back, we see a lot of those also, but most people clearly don't want neck and back surgery under almost any circumstance. But knee and shoulder are pretty common. So it's really helpful if we can find alternatives for you not to have surgery, because the surgeries tend to not be very successful. And if they are successful, you tend to need another one, but you lose range of motion and get some scarring in there. So let's go through the shoulder here. Now, this is something I'm very familiar with. I went out I was benching for most of my life through football, and I went up actually tearing the labrum and tearing the rotator cuff. It took 2 years to get this thing fixed, and I'm going to show you how I did it without surgery. But let's walk through a little bit of the anatomy of the shoulder. So what you're looking at here is straight through. Here's the ball and socket joint. Here's the humerus. This is your arm bone. So this would be your deltoid right here. This is your clavicle, which would be that bone that comes across right through here. And then this is the scapula, which is the wing that you have in the back. And this is where this connects right in through here. Now, there's 4 ligaments and muscles that make up the rotator cuff. And this is most commonly what we see people tear, pull, sprain. Pitchers do it all the time. Pretty straightforward stuff. You can do physical therapy, rehab. Sometimes we can adjust the shoulder if that's what needs to get done. But in general, if you've got a sprain strain in the shoulder, it's pretty straightforward. I like the all-natural anti-inflammatories, turmeric, multiflex. This is one of the joints I do recommend that you rest, you ice, you heat, you compress, alternate between the heat and the ice. We typically do ice for about 5 to 10 minutes, freezing cold packet, and then heat for 30 to 40 minutes. And you want that contrast that helps move fluid in and out and also brings some healing enzymes to the area. So that's a really straightforward way to deal with this. But shoulders are interesting though, because shoulders move in almost every direction. And once you get an injury to the shoulder, you can have very normal movement in one area, and then in other areas is just excruciating. So people tend to live with chronic shoulder pain way longer than they have to. Since there's these 4 ligaments, you typically only hurt 1 or 2 at a time, because if you hurt all of them, you usually go in and get the MRI and you get that taken a look at. So for the shoulder, again, you want to do the rest, ice, compression. I do recommend alternating the heat and the ice. 5 to 10 minutes of the ice, 40 minutes of the heat. Your anti-inflammatories, I like the all natural ones, but the shoulder in particular is a great one to do exercises with. So if you want to look some up, you Google rotator cuff. Most of them are internal, external rotation. Crawl your fingers up the wall. Don't skip them. I know they're boring. They seem like nothing's happening, but it does help break up the scar tissue. It does help bring little inflammatory responses to part of that shoulder that your body needs to heal it. Because remember, when you break parts of your body down, it triggers a chemical response for the body to put healing into it. So let's say you don't do anything to your shoulder because it hurts. Or you got bad advice that says don't move your shoulder because it's injured. Now, I'm not talking about injuring it if it's just excruciating, but you typically want to get moving the joint, because if you don't, it turns into what's called adhesive capsulitis, which is also known as frozen shoulder, and that's brutal. When we have frozen shoulder cases come in, we got to get that joint moving again. So we intentionally need to go in there and break up scar tissue all over again, just like the Tin Man. You got to get things moving again. So once we see that if the exercise is working, the rest, the ice, the compression, the good diet, it's really important when you have these kind of joint injuries that we don't contribute to more osteoarthritis. And all osteoarthritis means is osteo means bone, and itis means inflammation, and osteoarthritis means bone inflammation. All arthritis, all of it is inflammation of the joints. Arthro meaning joint, itis meaning inflamed. So a lot of people come in and they say, oh, my shoulder's killing me. And it's right here, and I'm like, oh, it's because you have arthritis. I'm like, oh, thanks, the doc, I didn't know what it was. You really told me what you had. You came in, you said, I have joint pain that's inflamed, and I just gave it back to you in Greek. I just told you it's arthritis, so I just gave you the same thing back to you. So it's nothing magical having an arthritis diagnosis, but what you want to do once you know it's arthritis, and you know or if it's a tear, or if it's a dislocation or a subluxation, we want to check these things out first so you get the proper diagnosis, and then from there give you a non-surgical alternative. And it usually always comes down to the same thing: the rest, ice, compression, cleaning up the diet, getting anti-inflammatory foods into your body, more of your fruits and your vegetables. Stay away from the heavy sugars, the artificial sweeteners. That does clearly help you heal. But when we get into the non-surgical pain relief that are outside of the stretching and the physical therapy and the heat, if those aren't working, then we're back into the next one. Now, we typically don't do hyaluronic acid into the shoulder. It is not FDA approved, although there are cases where we can do off-label and that does help. But the shoulder is different than the knee. It has a different stress point. It has a different orientation. It has way more range of motion here. So what the best therapy, in my opinion, is, and I've already done this myself, is PRP for the shoulder. So we'll take an x-ray of a shoulder, we'll do some testing on you, we'll do an ultrasound and see where the damage is. There is a certain window to PRP. So with PRP, there's 4 phases of degenerative arthritis. We typically want to see you somewhere before the end of phase 2, but really not past midway through phase 3. This is our window for PRP to get really phenomenal results. Once you get past that window, then you're into either a more aggressive stem cell therapy or you're into surgery at that point. So when you're in this range here, the PRP is phenomenal. We typically do about 1 PRP injection a week for about 3 weeks. Literally when mine was done, I couldn't move, I couldn't bench, I couldn't do external rotation, I certainly couldn't abduct my arm. And that was for almost 2 years. 4 days after my first PRP, full range of motion, full strength. I went back in about 2 weeks, back to the same weight that tore my shoulder. I know it's not a smart move, but I'm not the brightest guy in the world sometimes. But what it did tell me is that it healed quickly and it healed thoroughly and it healed all the way down to the cellular level. Because like I said, I've been doing physical therapy and rehab for a while and I could feel, even just as little as taking the bar, when I would push back, I could feel the tear, I could feel the injury. Literally weeks after my PRP injection, even on the deepest movement, even with the weight that I probably shouldn't have been doing, but I really wanted to test it out to see if it was strong, full strength, full recovery. So I was in the perfect window for PRP. I'll probably be going back again for kind of some booster shots to make sure the healing takes place. Because the beauty of PRP is this, even if there's not a problem, or even there's a minimal problem, there's no downside to it. There's no side effect to it. If we put it in correctly, we pull it out and there's low chance of infection, we do it in a sterile environment, it's your blood, it's your growth factor, it's the things, it's the enzymes, it's the proteins, it's the electrolytes that your body's already making just at a higher concentration. So it helps heal all kinds of tissue in there. And then if that doesn't work, or if you're too far down the road, then we'll talk about stem cell therapy. And stem cell therapy, we want to get a lot more accurate on where we're doing the injection. And we want to get a lot more history from you to see if that's actually something that'd be worth your time and your money. And if that's not the case, there are cases where we see that there's just no joint space, or we start to see the bone fuses together, or we see that there's actually old fractures in here. There's some things that nothing fixes other than surgery. So if you've been dealing with some serious shoulder injuries or chronic injuries and you're looking for that non-surgical joint pain solution, click the link below, bring your medical information, and I'd be more than happy to sit down and go over this with you.